All right, I'm Alicyn Gleesing, and my discussion on music and how it may be used as a source for clinical treatment. What is it? So, music therapy is the use of music to accomplish clinical treatment goals. These goals could be stress reduction or quality of life improvement. It's going to be whatever the end goal is for the patient. Why would one need music therapy? So, music therapy is quite common and it can be helpful in many clinical cases. Patients getting music therapy mainly suffer from mental health problems, substance use disorders, or brain disabilities and disorders. So, that's going to be patients who have dementia, Parkinson's, autism, anxiety, multiple sclerosis, or people who have had a stroke, just as some examples. All right, so what does music therapy look like? Music therapy tends to be program specific. No music therapy case is going to look alike. A music therapist needs a degree in music therapy, and they're going to plan these sessions out for patients in a program. It looks many different ways: inpatient, outpatient, alone, in a group. So this is going to be done in places like hospitals, mental health centers, resident facilities, treatment facilities, places where people are going to go to get treatment for typically brain disorders. So, what do these sessions even look like? Sessions typically are active listening to music and then discussion afterwards. So that's going to be actively paying attention to what's happening in the songs, actively trying to feel what is going on. So that could be singing, moving to the rhythm, to the beat, dancing, basically just feeling the song, moving to it, singing along, discussing the lyrics, and talking about how you feel afterwards. And then, or it could be actively creating music. So, composing lyrics, playing an instrument, improv. You're going to be creating what you feel into song. All right, so why is music used as a clinical treatment? Music therapy is all about the brain. So, music is processed in both hemispheres of the brain, actively, and it's like actively engaging and activating all parts of the brain when you're listening to music. So, this quote from Integrated Therapy of Northern Colorado says, "When we participate in music, the level of dopamine, which is the brain's reward chemical, increases." Meaning that music is a powerful tool to help with the neuroplasticity of our brains. Neuroplasticity is the brain's ability to develop, change, grow, get stronger. So activating the brain to do this, like listening to music, is going to activate the brain. Music therapists can reach areas of a patient's brain involved in helping them with their treatment. So music therapists know when activating the brain, they can use those certain parts, certain songs. That's going to help them with the certain parts of their brain that they need treatment in for whichever their disorder is. Which sounds a little confusing, but it's all about the brain, really, and how music is just going to activate the chemicals in the brain and just make you treatment. So, therapeutic benefits. The therapeutic benefits of music therapy can be mental, emotional, cognitive, social, or physical. So it's going to be music that the patient likes. Because if the patient is sitting there not interested in the song, then they're not going to feel those benefits. So it has to be music this patient likes. And all these benefits are going to be a result of touching the different parts. So that's what these benefits are from. All right, mental benefits. Helps form healthy coping skills, strengthens self-confidence, develops problem-solving skills, helps organize and retain information, memory. So that's really what's going to help dementia patients, is organizing and retaining information. And then emotional benefits: reduce stress, reduce anxiety and depression, and explores emotions. So the dopamine levels that music produces is going to help reduce stress and reduce anxiety. It's going to exploring emotion. Music is a very emotional thing. Many different types of music explore many different emotions, and that's really going to help patients. Cognitive benefits. So it's going to help you improve language skills, improve speaking skills, and improve motor function. Social benefits: builds social skills and strengthens communication skills. Strengthens communication skills. It's really going to help what builds up those social skills. It's going to strengthen, listening to the music, discussing how you feel with a music therapist. It's probably going to be out of these patients' comfort zones. So that's really what's going to help build those communication skills. And then physical benefits: reduce perceived pain levels, aids in the timing of movement, and improves coordination in movements, through moving along to the songs. So, on the American Music Therapy Association, there was one clinical case that was really moving and unique. So this boy named Jimmy, he was not able to walk. He had to use a walker. So he was getting treated through music therapy. Extraordinary case. He was 11 years old, and he took his first steps. After all those years, took his first steps through the treatment of intensive music therapy. He took his first steps to Justin Timberlake's "Can't Stop the Feeling." So it was a song that he liked. It was upbeat. He probably felt like moving around. And that's really what got him to touch those parts of the brain and finally taking his first steps after 11 years with no aid. So Jimmy's mother stated, "Thank you for making Jimmy so happy with a gift of music that we know runs very deep in him." So that's kind of a touching story on how you can really see how music therapy can really change someone's life, and how the dynamics and just the power of music can reach all those parts in your brain and activate all those chemicals to just changing somebody's behavior. All right. And then here's my bibliography. And there's 2 pages of it for all my sources. All right. Thank you.